our next door neighbor. And
Can you hear me? No? It's not on. All right, so, is there anybody in the room that knows how to turn off the microphones in the system?
Hey, B-boy.
It's in the closet, but
Skeleton
I
today,
think
Bob.
it's locked.
No.
Oh, no. Just what I know.
Thank you. Nice job, Chief.
Not me.
Welcome, everybody. I appreciate everyone's attendance this evening. This is as I had said at a previous selectmen's meeting, this is probably one of the most urgent subject matters that this community faces today. And the Board of Selectmen recently, during our goals development meeting, this was one of the major goals that we have established for this fiscal year. It's an important subject, not just for the town as the town, but also the parents, the schools, the churches, the kids that are all being swept up in this insanity that has been going on. And I am hoping this evening, as chairman, I should introduce myself, I am Rick Jennett, chairman of the Board of Selectmen. And I am hoping this evening that this is the beginning of a collaborative that will improve all of the relations amongst all of the organizations that are represented here tonight so that we can begin to solve this crisis together. And it's wonderful to see everybody here to begin that process. First, what I would like to do is note that my fellow members, Mr. John Conlon, Ms. Sue Salamoff, and Mr. John Friedman are here this evening as members of the board. Mr. Mabarty, we are waiting on, and hopefully he will show up shortly. Our town administrator, Ms. White, is in attendance, as well as our state representative, David Linsky. This is, as I said, it's an important process that we have to undertake. Again, thank you for coming. I'm going to pass the microphone, literally, to our esteemed Chief of Police, Mr. Chief of Police.
And make it too loud. Thank you, Rick, as chairman of the board and other Board of Selectmen members who are here. This is now a great opportunity for many people who are going to be in the room tonight to, given part of what, in preparing for this, we looked at it as a response, the town of Natick response to the opioid, and some people call it issues, some people call it crisis. Regardless of how you title it, is one that needs to be discussed, need to discuss at the local level. My role today is to just introduce the day and introduce the night as far as the speakers. We have just a few speakers who are going to talk to you tonight and make a presentation. But the bulk of the night, we hope to have some very good discussion and questions. We have members in the audience who have been working this issue in town for quite a while. So hopefully we will have that kind of dialogue here tonight. As was stated earlier, we were requested to by the Board of Selectmen to put together a presentation. So what you're going to see tonight by those who are presenting is to get you thinking and to get your thoughts going. I must say, I want to just say that at each table, at the end of the night, at the end of the presentations, we are going to have an opportunity for questions, answers, comments. So we've placed in each seat should be a index card with a pen. For those who may not feel comfortable standing up and making comments, you will have the opportunity to write those down. We will have volunteers who will come by just before the beginning of the comment and question section and gather those so your questions can be asked and can be answered. So when we get to that point, we'll remind you of that. Doesn't mean it has to be on the card. That's not necessary. If you'd like to get up and ask a question, we'll have that opportunity also. So let me start by letting you know the speakers tonight, you're going to hear from Katie Sugarman from the Natick Youth. You're also going to hear from Tim Luff from the Natick Public Schools. And finally, you're going to hear from Cheryl Center, who is with SOAR. For those who don't know, it stands for Support Our Addicts Recovery. And in the audience, I just see a couple faces I know who are here to answer questions if need be. We have Rick White, our fire chief, who's here to support us. Rick, you can speak off the table. We have Jim White, also from Health Department here in town. I have Lieutenant Rossi Caparelli, who's my operations commander for the police department here also. Did Jim Lambert arrive yet?
She's got a lightning problem in her house.
Yes, she said that to us. So that's the order of speakers that I have here tonight. Like I said, there's 5 other members in the audience. But let me start off from our perspective. I'm going to start off from the law enforcement perspective as we get the night started about this particular issue and where we've come from in a short period of time. Back in 2002 and 2013 is when law enforcement started to see a rise in heroin-related overdoses. And it's important that you keep kind of follow me along. So we're talking about 2012, 2013. At that time, that came on the heels of the uptick of OxyContin use and related crimes. If you can remember, we had a lot of robberies of drugstores and things like that carry OxyContin at the time. So that's what you were seeing from law enforcement at that point in time. And during this time, just 2012, 2013, admittedly, some of the smaller towns were not paying attention to this trend. And I think Natick was one of those. So it was one of those that it's a big city issue, big city concerns, not something that we have to pay attention to. In 2013, law enforcement at the federal level, we're talking about the Department of Justice and the FBI and the DEA and the ATF, began to see a concerning trend in the use and abuse of certain narcotics. With this concern, notice went out to all law enforcement, community. And this is what was said. This is what was reported to all law enforcement community in early 2013. Threat from heroin has increased dramatically since 2017. Now again, these are all quotes that we all received in the report. Heroin was available in larger quantities and used by a larger number of people. Again, trending in 2013. Heroin overdose deaths have increased in many cities and towns, especially in the northeast of the United States. Heroin availability is increasing in all areas of the United States. In 2013 also, we started to see the arrival of fentanyl at that time. And here's some heroin facts that came out back in 2013. Between the years 1980 and 1990, the purity has increased significantly. What we're seeing is the heroin purity has increased, and the price has decreased. It has spread to a broader group of users, so the broader users at that time, starting in 2013, was more diverse. There is no longer a typical, quote-unquote, heroin user. That no longer exists. Heroin is far more deadlier than any other drug at this time. I just want to repeat that. Heroin is far more deadlier than any other drug at this time. And finally, some heroin facts. More people at this time are seeking treatment for heroin than any other illicit drug at this point in time. Those facts alone should open our eyes, and we should understand what's happening around us. But this data is available to law enforcement, and it's still not clear, especially the law enforcement's role was with this quickly emerging problem. We still didn't know. What were we to do in law enforcement? In fact, in 2013, we specifically the Natick Police Department, could not produce data as to the number of overdoses in our community in 2013 because we weren't tuned in. We simply did not record it. We knew that what was occurring, but we could not produce the data to show any trends. And we know that as Americans, we respond to trends and data. Officers were clearly aware of the incidents that were happening, but the mindset was simply that it was simply another drug overdose. Probably the typical response of most police departments in our country at that time. Law enforcement, and especially the Natick Police Department, have come to realize and commit to being partners in the community in solving this major issue. We realize that we cannot do it alone, and based on history, we need to work on the perception that we, meaning the police, are out to arrest those that need help. This requires a lot of work and a lot of commitment from this organization, but we have pledged at the Natick Police Department to make a difference in this community. We have partnered, and that key word partnered, with many of the organizations that you'll hear from tonight, and hope that that partnership will grow and become even stronger after we meet here today. It wasn't until the beginning of 2014 that I believe, in my opinion, that the town of Natick and the rest of the Commonwealth as a whole opened our eyes and took notice to this issue. In January of 2014 and March of 2014, this town suffered opiate-related deaths. This time, these deaths did not pass as simply a call for public safety needs. These deaths had an impact on this community that was profound. These deaths for the families and friends of the victims spurred anger and resolution to fight this problem. Coincidentally, the nation and the Commonwealth had also been awakened to what had been missed for many years. Unfortunately, when this awakening occurred, we were already thrown into a full-blown epidemic. We were way too late. So much so that Governor Deval Patrick declared a public health crisis, growing into the opiate addiction epidemic in 2014. The theme for tonight, as we have heard, is going to be current efforts and discussions and future needs for the town of Natick. My colleagues and partners who will speak here tonight will on these issues shortly, but let me give you some facts and figures as we move into our discussion here tonight. The Mass Department of Public Health has reported opiate-related deaths in the state, in this Commonwealth. In 2013, it was 911. 2014, 1,282. 2015, 1,379 opiate-related deaths in the Commonwealth of Massachusetts. In Middlesex County, bringing it in, Middlesex County, our district attorney reported that overdose deaths in 2013 was 80 in 2013, and 33 of those were related to heroin. 2014, 145 deaths due to overdose, 103 due to heroin. 2015, 185 deaths due to overdose, 142 due to heroin. And to date, in 2016, 134 deaths and 93 due to heroin. That's down to our county. In our town, the town of Natick, 2014, we had 23 overdoses and 3 deaths. 2015, 24 overdoses and 2 deaths. And to date, in 2016, these numbers are for June, so half the year, we're at 18 overdoses and 3 deaths. Last time we presented, group here, we presented in front of the Board of Selectmen in 2015 on this very issue, February 2015. As you can see from the date, even from 2015, after a declared public health crisis / emergency, declared public health emergency, even after the establishment of reports from several task forces that have been put together at the state level, and even after all that notoriety. My statement in February 2015 stands true today. There needs to be a town-wide approach to this problem. There's been a tremendous amount of grassroots efforts locally, tremendous amount. We need to step it up even further. For this great supportive community that I've seen, we all need to educate ourselves on this issue, and education is key. We need to educate ourselves on this issue. With education, we will come to a realization that we are not immune. We are not immune from this crisis and this emergency. Our friends and neighbors are suffering, some in silence, still. Ignoring this issue is no longer an option. It is no longer an option. Through education, you will learn that there is no longer a single profile for someone addicted to heroin or opiates. It no longer exists. There's no longer a single profile. Right now, you can turn to your right, you can turn to the left of those who are sitting around you, and you will see the current profile. It could be anyone in this room. We can no longer judge. We have to destigmatize this addiction issue in order to help our neighbors and our friends. And that must start tonight. So thank you for listening to me. I want to bring up now Tim Luff from the school department, who's going to speak about the school's response to this particular issue. And thank you for your attention.
Thank you, Chief. Thank you, members of the Select Board. Very much appreciate everyone that's in attendance tonight. I'm Tim Luff. I'm the Assistant Superintendent for Natick Public Schools. On behalf of Dr. Secchione and Dr. Nolan, we are certainly cognizant and aware that it's a significant issue in our community. Look at it seems to work.
Yeah, just in case you
I'm going to switch clickers quick if you don't mind. Thank you. So I should just say that Natick Public Schools is committed to working with the town in what is a significant issue that is having great impact on our community. This is a community issue that requires a community effort. To that end, we have implemented curriculum in our classrooms, allocated resources to screening, prevention, and intervention, and have infused knowledge regarding opioids in many aspects of our educational and athletic programming. We have teamed up with the Natick Together for Youth and other departments and agencies to ensure we are meeting this issue head on. I'm going to start by looking at the data from the Metro West Adolescent Health Survey, conducted in November of 2014. We do have a new survey coming out this coming November, so the data will be updated soon. I'm going to be looking at the curriculum, implementation, and development of the Natick Public Schools. I'm going to be looking at the Department of Elementary and Secondary Education initiatives and requirements around legislation. We're doing screening, prevention, and intervention options in Natick Public Schools, athletic programs, and community partnering. To start with the data, this may seem like it's not much, but this is from the Metro West Health Survey, Metro West Survey from 2014 on middle school students and prescription drug misuse for students in 2014. 1% of our 6th, 7th, and 8th grade population in 2014 have misused or had misused prescription drugs in a lifetime. I say this because we moved towards the high school in 2014, and at that point in time, 5% of our 9th grade students have misused prescription drugs, 6% of our 10th grade students, 8% of our 11th grade students. In fact, 1% in our 9th grade had used heroin, 2% of our 10th grade had used heroin, and 1% of our 11th and 12th graders had used heroin at that time. When the survey was taken, current prescription drug use within the past 30 days was 3% of our 9th and 10th grade classes, 6% of our 11th grade class, and 4% of our 12th grade class. And in the past 12 months from when the survey was taken, 7% of our freshmen, 4% of our sophomores, 10% of our juniors, and 3% of our seniors were offered, sold, or given prescription drugs on school property. Trends during that time, using heroin, the first chart is 2006, or the first bar is 2006. 4% of our students in 2006 had used heroin, 2% in 2008, 3%, and 3% in 2010 and 12, and 2% in 2014. The misuse of prescription drugs, although going down slightly, 13 to 8, 8 to 7 to 6, is significant. However, we'll see what happens here in November. We know this is an issue, but that is the data. Finally, current prescription drug misuse within those 30 days of the survey was 5% for the first 2008, 10, 12, and in 2014, 4% of students had current prescription drug misuse in the past 30 days. And in 2014 and 12, 6% of our students had been offered, sold, or given prescription drugs in the last 12 months. State average comparison to states, you'll see Natick here in the blue. And you'll see that Natick, compared to the rest of the state, is on par with ever using heroin in their lifetime. Ever misusing prescription drugs, 6% compared to 7% in the Metro West area, compared to 18% in Massachusetts. Ever misusing prescription drugs in their lifetime. Look at the same charts today. I'm going to skip to the next one. Offered, sold, or given prescription drugs on school property. Natick was 6%, and the Metro West area was 5%. I talk about that data because we need to talk about what we're doing about it. We know it's a significant issue, and the data shows that. We know that 56% of access to prescription drugs comes from a friend. We know that 10% of students get these drugs from a parent without their knowledge. We know that 6% takes them from someone else without their knowledge. We know that 4% bought them someplace else, and the other, I assume that's getting them in places that we do not know about. However, we know it's an issue. We know our students have access to these drugs. So what do? Well, we have a middle school curriculum that currently focuses on receiving information on drugs, alcohol, and their effects on the body. We know that current research and our work through our health audit are leading us in a different direction. This summer, the middle school health teachers, guidance department, and nursing staff are revamping the health curriculum to incorporate research-based instruction that focuses on leadership and resiliency skills around the use and experimentation of drugs. Not just that they're out there, but the resiliency around them. The high school has a current health curriculum that includes 160 minutes of opioid education for students in grade 11. If you look back to that data, you saw that grade 11 was the high point for us. We focused our curriculum in on that level. The staff spend 2 days classifying street drugs and their use of students. These lessons focus more on analyzing how they work factors that contribute to their abuse, ways to prevent their abuse, and how to get help for someone in need. They do this through direct instruction, group work. They actually create pamphlets and presentations and share them with the class. And they do think-pair sharing activities. Staff also cover addiction scenarios and refusal skill role-playing. The Department of Elementary and Secondary Education came in after legislation required and requested that we provide substance use prevention and abuse policies. We're still waiting for ultimate guidance from the DESE on what that will look like and what the instructions should look like. They require substance abuse screenings within our schools, and they require concussion education for our students and what opioids and the use of opioids do with concussions. So as we await further direction from DESE, we're developing an opioid education to be delivered to all students at Natick High School this fall. Our current projection and our plan for that is to host 40-minute assemblies for students in each of the 4 grades, so that every grade level has a piece in education component regarding opioids. We conduct SBIRT screenings. That is, screening, brief intervention, and referral for treatment for all students in grades 7 or 9. Those screenings focus on drug and alcohol use and other risky behaviors. If a student is screened positive, appropriate interventions are put into place. Safety plans are developed that include possible parent communication, individual one-to-one education by healthcare professionals, and follow-up. Referral for treatment by outside professionals are made on an as-needed basis. Hey NHS, How Are You? Is a grant funded through the Mental West Health Foundation, another one of our partners, based on the work of Dr. Tracy Gladstone from Wellesley College, and that will continue into next year. The expansion of this program will expose students in grades 7, 8, 9, and 11 to the signs of suicide curriculum and continue to screen students for depression and self-harm. Working with Dr. Ruth Pote, a physician out of Greenfield, we have developed talking points with families and students regarding post-surgery or injury pain management. It's a script that our nurses will use, and they'll call the families and the students, and it will act as a screening tool and education intervention on the appropriate use and disposal of opioids if those are so prescribed with a concussion. Based on the information received by these screening tools, we identify primary and secondary issues not only around substance abuse, but around greater mental health needs. We use the data to support our students in addressing these concerns. Narcan. It's a life-saving drug. It mitigates the effect of opioids in the body. Natick Public Schools stocks Narcan, subject to stock other life-saving drugs, such as epinephrine, in each of its clinics for emergency circumstances. Natick Public Schools, thank God, has not yet had to administer this drug. We have a diversion program. In collaboration with the Natick Police Department, NCY, Natick Service Council, the Natick Public Schools offers a education program in lieu of charges and suspension for substance abuse. We have Interface, which is a referral service for students and other community members to access mental health services for treatment purposes. It's a telephone number, you call, you get treatment. Athletics. At the start of each sports season, the athletic director hosts a meeting for players, parents, and coaches about the upcoming season. NCY and MPS Nursing Department will present information on opioids at those meetings and require that the coaches sign off on that training. Opioid education will be added to the concussion screening and training for athletes. All athletes are required to watch a concussion video as part of the registration process. NCY and MPS is putting together a handout about opioid use with naming specific numbers. Students will be required to document at the time of registration that they have received and reviewed this handout. Students found to be under the influence or possession of drugs or alcohol may continue to access the diversion program in lieu of suspension. Student athletes will not be able to avoid MIAA game suspensions without participation in the diversion program. The program includes education as well as community service. As Chief said, it is about education. Community partnering. NPS continues to work closely with NCY and other agencies in the community to discuss and support this issue around our students, for our students. We work with SOAR, Metro West Health Foundation, Mass Department of Public Health, Spark Kindness, the Natick Police Department, the Natick Fire Department, Natick Service Council, Natick Recreation and Parks, Natick Health Department, local mental health agencies, community-based justice programs, and many more that could be named. This is a community-wide effort, and we're working together. Natick High School students actively participate in NASA, organization Natick Against Student Substance Abuse, remote quality decisions. In her presentation, Katie Sugarman of NTY will talk about the significant number of community events that have collaboratively been planned and run together with the Natick Public Schools. It is our hope that this evening we broaden our approach by coming to you, community, to facilitate the continued efforts to prevent and eliminate this crisis by pushing forth a more significant community effort. Thank you for your time and consideration of this ongoing issue in our community. There is a question and answer session following.
Sorry. Can we get them? Yes, we will. I'll get it up.
And thank you, Tim. Like I said, we will have a question and answer session. And we just want to get through the speakers first, so we make sure that we get all the presentations made and have plenty of time for questions and answers. I'd now like to invite up Katie Sugarman, who is the Executive Director from Natick Together for Youth, who will, her presentation will be very broad on the town's response, at least the town's group's response to this particular issue. Katie?
Thank you. My name is Katie Sugarman, as Chief Hicks mentioned, and I am the Director of Natick Together for Youth. I am so grateful to see so many people here tonight, and I just thank you 1,000 times for being here in the middle of July on a somewhat rainy evening. It kind of looks like the clouds could open up at any time, but thanks for making the effort to be here. Just as a little background, this topic is really near and dear to my heart. I've only been here in Natick doing this work since December 2013 is when I came here. So if you think back to the timeline that Chief Hicks mentioned around January 2014 and early 2014 when we had a couple of fatal overdoses, it was right around the same time I had come to Natick. Prior to that, I'd been doing drug and alcohol prevention work for the city of Revere. Actually, I worked for the Revere Cares Coalition, which was sponsored by Mass General Hospital. And for the 5 years that I was there, really the predominant focus of my work was around opioid prevention. So this is a topic that is extremely near and dear to my heart. And to those of you in the audience who are in recovery or the family member of somebody who's struggled, I thank you for being here, and I thank you for participating in this conversation, because I have learned so much about this work, more so from the people who have lived it, who have the lived experience of what it's like to love someone or to be someone who has struggled with this disease. It's easy to pull things out of books and talk about public health trends and data and stuff like that, but the people who are living and breathing this every day are the people who have taught me the most, and I just appreciate the honest discussion that I'm sure we'll have here tonight from your experiences. So thank you in advance for that. So just to kind of give folks a quick overview of what NTY is, because sometimes people in the community aren't really aware of Natick Together for Youth. It's basically a drug and alcohol prevention coalition. So it's a group of community members from across Natick who are really focused on trying to promote a safe and healthy drug-free community. So the idea is that we want to promote protective factors in the community that will encourage our youth to stay drug and alcohol free, or to make healthy decisions around drugs and alcohol, and to try to reduce risk factors for youth substance use. And our vision is of a community that's strengthened by substance use disorder prevention and treatment efforts. So currently, NTY is funded completely by federal grant monies. So I'm the only full-time person working for the coalition. We have a research evaluator who works with us for about 5 hours a week. So it's a very, very limited capacity. And those federal grant funds actually will be expiring at the end of September. So we have resubmitted an application for those grant funds, which if we get them, knock on wood, would give us another 5 years of funding. However, that is very up in the air at this point, and we won't know until August or even possibly September whether or not we have funding starting September 30th. That is unfortunately how that is the nature of the federal grant funding cycle. The good news is that in working closely with the school department and other representatives of the town, we have at least been able to pull together enough funding to sustain my full-time position for at least 1 year. But beyond that, there's still the question mark of what we would do if we don't get those federal grant funds. And I should clarify that Natick Together for Youth is really, it's a town-wide program. The Natick Public School Department is the fiscal agent on the grant. That's a requirement for grants, that you need to have somebody who's managing the monies and so on and so forth. But I am really, Natick Together for Youth is really meant to be a program of the entire community. So while we work very closely with the schools, and I'm physically located at Natick High School, I spend a lot of time over at the police department and at town hall, and I'm constantly running around town, it seems. And it's probably a little difficult to see all the different categories here, but as part of those that grant requirement that I mentioned, we actually have to have 12 sectors of the community represented in the coalition. So we have individuals from each sector here as part of the Natick Together for Youth Coalition. So that includes youth, that organization that Tim mentioned, Natick Against Student Substance Abuse, is actually a youth group that was founded 2 years ago now as a joint partnership between the public schools and Natick Together for Youth. So we have a youth group at the high school that is all made up of youth peer leaders who are focused on promoting a drug and alcohol-free lifestyle. We have parents involved, school administrators and staff, healthcare professionals, law enforcement, religious and fraternal organizations in town, civic and volunteer groups, youth serving organizations, businesses, media, local government agencies, and organizations involved in reducing substance use. So that could be, for instance, the Mass Organization for Addiction Recovery. We have a representative who comes to our coalition meetings. We have local treatment providers who come to our meetings on occasion, and we meet on a monthly basis during the school year, September through June. I should also mention that we have a board for the coalition, and actually our current chair of the coalition is Jim White, who's our director of the health department. But we also have representatives of the school department, as well as volunteers from the community who serve in those leadership positions on our board to help us kind of steer our work. So this is just this is public health 101 in one slide. So this is going to be the most basic information you'll ever get about public health. But basically, when we're talking about prevention work, we're looking at a continuum. And you can see, I don't think this has a laser pointer and it doesn't. If you look at your far left, starting at the health promotion end of the spectrum, you then move from promotion into prevention and then treatment into maintenance. So on the right hand of that semicircle, you've got supports and resources and services that really target helping those who are already engaged in substance use, helping them either reduce their risks or access treatment if that's what they want, or if they want to sustain sobriety or recovery, helping them access those resources. The funding that NTY has, that federal funding that I mentioned, the Drug Free Communities Grant, is really focused on prevention. And so the focus of those grant monies are mostly on that left-hand side of the semicircle. So focusing on prevention efforts within the larger community, and then down into like the schools in particular, are working closely with youth and families and folks who work with those populations to try to prevent the onset of substance use, or if substance use is starting, trying to put in interventions as early as possible to help those young people in order to avoid longer-term substance use. So I just mentioned that because and I think we'll be talking about some of the challenges that we face. One of them is that the current funding that we have as a coalition focuses so much on that left side of the sounding circle, which is absolutely important because, as Chief Hicks said, this problem is getting worse rather than better, and I'm concerned that we're still years away from seeing the dip in numbers that we really want to see. But we can't stem the tide if we're not doing some of the early prevention to try to help those kids who are in elementary and middle school and high school prevent use in the first place. But some of the immediate needs are on that right-hand side of the circle. The folks who are actively using, folks who are in early recovery, their families, those are areas where supports are really needed and where we're a little bit more limited in the time and resources we have to put into it, and we need as a community to work more in that area. So also just to kind of let folks know that we are not doing this alone in terms of Natick as a community. The town is now newly a part of a couple of collaborative grants with other communities in the Metro West region. The one that most closely relates to this topic is actually the Massachusetts Opioid Abuse Prevention Collaborative. So those are state grant funds that come from the Mass Department of Public Health. So you had, in order for a community to be a lead on this grant, you had to meet certain parameters of like population size and overdose rates and that sort of thing. Framingham was too small to qualify as a lead community on that grant, but Framingham did qualify. And so Framingham went for that grant and invited Natick and Ashland to be partners on that grant. And so we are now partners. They only got this in May, so we're still in the early stages of getting our kind of marching orders from Framingham on what we need to do as we go forward, but we know that some of the basic requirements will be for us to start convening an opioid-focused working group here in town to work on this issue, and that we will have to ultimately do a community assessment about the opioid issues here in town, and then we will have to work with those partners in Ashland and Framingham to actually come up with some regional strategies that going forward would help the three communities hopefully together. Because as we all know, you can't fight this issue community by community, because you can live in one community and you can buy in another community and you can use in a different community. And so we all need to be working on this together. Another regional grant that we just became a part, we just joined February, I guess we officially joined, is the Metro West Substance Abuse Prevention Collaborative. That's again another grant fund from the Mass Department of Public Health. In this case, Hudson is the lead on it. It's focused on underage drinking prevention, and that includes Natick, Ashland, and Framingham, Northborough, and Southborough. As we're trying as much as possible when these grant opportunities come up to involve some of the same communities so that we can build up more infrastructure and establish working relationships that could allow for some good sustainability and hopefully some good results as well. Additionally, I go to monthly meetings with the Metro West Substance Abuse Prevention Alliance, which is just basically a group of people like me who work for different communities in Metro West who felt like we needed to talk to each other more in order to share resources and to coordinate our efforts together better. And so that includes probably about a dozen now communities, and we meet monthly to look at a variety of substance use related issues. So opioids are definitely probably one of the topics we talk about the most, but certainly talking about underage use of alcohol, marijuana, and other substances. And then another task force that is very new that I know the health department and the police department send representatives to, and I have been trying to attend as well, is the Central South Middlesex DA's opioid task force. So our Middlesex DA, Mary O'Brien, actually has had an opioid task force in the northern part of the county for several years now, and she's worked very closely with Lowell and some of the surrounding communities coming up with strategies and interventions to serve some of the populations up there, because some of the highest overdose rates in Middlesex County have really been concentrated up in northern Middlesex County. But the model has proven so successful up there that she wanted to convene a similar task force down here for the southern part of the region. So those task forces that task force has just started convening within the past 2 months, I think. And so that's again another opportunity for law enforcement and public health officials and prevention specialists to work together on how can we address some of these issues together. I apologize in advance that the data on the next 2 slides are extremely outdated. Unfortunately, it's just because it takes that long for the Mass Department of Public Health to release new data to us. And I actually checked today just to make sure there wasn't something more updated, and this is the best I could find. So this data is going from 2002 to 2011, so that decade leading up to some of the years that Chief Hicks was talking about. And you can see in the dark orange line that starts on the bottom and then shoots up at the end, and then that is the town of Natick, and then that kind of pale yellowish color that kind of is a steady increase across the board. That is for the entire state of Massachusetts. Excuse me. Now these are rates that are adjusted for a population of 100,000. So you can see next to that orange line there's an N of 96. That means that over the course of that period of time, from 2002 to 2011, there were 96 opioid-related ER visits from Natick residents in that period of time. If you adjust that to a population of 100,000 people, which obviously Natick is a lot smaller than that, that would be like the equivalent of 335 people. Now, those Massachusetts numbers, on the other hand, if you were to adjust those down from the size of the entire Commonwealth down to a population of 100,000 people, the state equivalent would be around 279, 280 people. So that's why over that same period of time, Natick is higher than the state average. Now again, this is old data. I don't know how it would look now. Unfortunately, I'm sure both numbers would be a lot higher. But I included this slide only to demonstrate that this issue didn't just start in 2013 or 2014. It may have become more a part of our collective consciousness here in Natick in the past couple of years, but this issue's clearly been building over time. And I know when I first came here and we had those 2 fatal overdoses within the first few months of me starting here, I got a lot of phone calls from people in the community who were very upset, and a number of them said to me, these are not the first people to die that I know of. My kid has seen several of his or her friends. Maybe they weren't Natick residents, or maybe they had moved away and then overdosed someplace else. But this is something that I know a lot of families have been experiencing for years. And then these are opioid-related ER visits for teens in the community. I'm sorry, teens in Natick compared to teens in the entire state. So on that far left-hand bar graph that is circled, between 2010 to 2012, so this is a much shorter period of time. We're talking 2 years here, 2010 to 2012. 30 teens in Natick who have Natick residency visited an ER for an opioid-related visit. So it doesn't mean they were prescribed opioids. That means they were there because whatever issue they were having, presumably an overdose of some sort, was related to opioids. So again, adjust those numbers for a population of 100,000, that would be the equivalent of 576 people in Natick if we were to shift our numbers. And then for the state, that would be the equivalent of 176 people. So again, that puts Natick well above the Commonwealth average for that particular population. But even if you look across those age demographics, 20 to 24-year-olds, 25 to 29-year-olds, the gap closes a little bit as we get a little bit older, but still Natick is above the Commonwealth average there. So again, I want to just acknowledge that these are outdated numbers. So to date, I'm just going to quickly review some of the overdose prevention, opioid prevention efforts that we've done as NTY and in partnership with a number of the other organizations that have already been mentioned here. These are kind of the broad categories that I'm going to divide things up into. So around education and community awareness, policy and enforcement, access to resources, programs and services, and then community connection and collaboration. So we've done a number of, we've participated in a number of educational events that Tim actually referenced. Over the past couple of years, we've had presentations by former Celtics player Chris Herron, who I'm sure a lot of folks here are aware of, and many of you may have even been at his presentation last November, that SOAR Natick really took the lead in organizing, and that NTY assisted and supported in. Prior to last fall, he had also come to Natick High School during the daytime to present to students, and NTY had sponsored that presentation. Dr. Pote, who Tim already referenced, who's just a phenomenal person on the state stage doing this work, she presented, again, in partnership with public schools, Spark Kindness, Natick Together for Youth, SOAR Natick, a number of partners working together to bring her here. And she actually presented last fall to, she actually did 3 presentations over the course of the day. She presented to students at the high school in the afternoon, and then right after school she presented to probably about 40 or 50 folks from the public schools and from the Natick Police Department, and then that night presented to I think probably 100 to 125 or so parents as part of the Resilient Parent, Resilient Child speaker series. We also did a screening of Anonymous People that was 2 Septembers ago. And for those who aren't familiar with it, it's a movie that really kind of talks a lot about recovery and kind of educating folks about why this is a time for us to kind of collectively come together and put a face and a name behind this issue, because for so long people have been anonymous and have been quiet about addiction, even though almost every one of us could name somebody that we know who has struggled with addiction, if not opioid addiction, some other form of substance use addiction. We also have been hosting for the past 2 years, and this spring we've been hosting a forum at the high school where we actually have 3 different events kind of running concurrently. We have middle schoolers in one room, and those students, those peer leaders I mentioned from NASA, they plan and run the entire session for the middle schoolers. And then we have a separate educational event happening for high schoolers in a different part of the high school, and then we have a separate educational event happening simultaneously for parents. So the hope is that if parents could come and know that they could bring their teen, and their teen could be getting education, and other, or maybe parents will be inclined to stick around and get some information too. And those topics have ranged in topics. For the middle schoolers, the focus has always been around how to be yourself, like yourself, be proud of yourself, and promote that that drug and alcohol-free lifestyle, and kind of demonstrate that there are lots of high schoolers who don't use substances and who are popular and feel good about themselves, and that middle schoolers can totally do that going into high school too. The high schoolers have gotten a variety of different educational speakers on topics like marijuana, opioids, underage drinking prevention. Chief Hicks has not always gone and spoken to the teens up in that session, and then parents have also heard from Chief Hicks and from local experts and from statewide experts on some of the same topics that I just mentioned that the high schoolers get. And then if you didn't get a chance to see it, Hidden in Plain Sight was an exhibit that we actually had at the Natick Mall for about almost 3 weeks in the month of May. It was actually a staged bedroom, which was open only to people over 21, but folks from the public could actually walk through. It was in a storefront in the Natick Mall. We had a great partnership with the mall. They were totally enthusiastic and behind us on doing it, which was awesome. But parents could actually come in, get some education about what opioids are, kind of why we're talking about this issue, what can lead to to opioid addiction, and then they actually got the opportunity to walk through what was supposed to be a mock-up of a teen's bedroom to learn a little bit about some of the signs they should look for, what does some of the paraphernalia look like, and they actually looked with resources on things they could talk about, questions to ask their kids, resources of folks they could go to if they felt like their teen needed help. We are in the early stages right now working on trying to do a kind of pop-up version of this at Natick Days. Hopefully, maybe even here at the library. I don't think that's been officially reserved to that yet, so so it's between us. But the idea is that we want to try to be able to bring this back into the community on occasion. And we did have about 400 people go through that exhibit at the mall. About 125 of them were from Natick, and then the rest were from all over Metro West. There were people from out of state who happened to be in the mall, folks from all over. And then we also have done a couple of opioid overdose prevention trainings, and this is the type of thing that needs to be happening way more often than we've had the capacity to do. But we did the first one back in March 2014, right on the heels of a couple of those fatal overdoses, and then we did another one just recently in June. But that's the sort of training that could be happening probably on a monthly basis if we could manage to find a way to make that happen. We did participate in the health curriculum audit that Tim referenced, and so when the schools sat down to kind of look at what are what are some of the, what currently exists in the health curriculum between the middle and the high schools, and where could adjustments be made. I sat in on those meetings and participated and made some of my own recommendations as a certified prevention specialist on some of the evidence-based curricula that currently exist. And then there's just kind of a smattering of different events throughout the school year that we partner with the schools on, and doing announcements during the school day, bulletin boards, going into the lunch sessions and doing Q&A quizzes with the kids and giving out freebies and trying to kind of educate students about drug and alcohol prevention related information, but then also trying to promote kind of an upbeat kind of optimistic viewpoint of like how much easier and better life can be without using substances, while also acknowledging that we do have to also support those students who may be struggling with mental health related issues. And there may be a reason why substance use seems like the easiest thing to deal with. So we often have resources at those tables when we're partnering with the schools on those things. And as Tim also mentioned, we are currently working with the athletic department on coming up with some trainings for the fall targeting athletes and their parents. A number of these things have already been mentioned or already exist. The fire department ambulance has been carrying Narcan for forever, I don't know, for years.
Since 2001.
2001. So since the fire department operates its own ambulance, paramedics have been able to carry that for quite some time. The police department has been carrying it in its vehicles since August 2015. Is that the date right? The police department has been organizing these medication take-back days at least twice a year for the past several years. But now there's also a permanent disposal box at the police department that sits in the lobby, and the health department was a lead partner in making that happen. It had funding that was able to bring that kiosk in and help with the actual disposal process. And as was mentioned, the nurses' offices at the schools also have Narcan now. We've also been trying to work more closely with some of our elected officials. So actually in February of this year, 3 adult members from the coalition and 5 of our student members went to a conference down in Washington, D.C. We got to have probably about 20 minutes with Senator Warren, got to talk about some of the drug and alcohol concerns that we have here in Natick, and we spoke specifically about marijuana and opioids, about some of our concerns there. And then we've also worked really closely with Congressman Clark's office, who's actually had some of her staff come to some of our coalition meetings and worked with us even on that hidden plain sight exhibit that I mentioned, and we are participating in that county-wide task force that I mentioned as well. So there is a pamphlet that I recently worked on with the police department, fire department, health department, SOAR Natick, that is at least a start at getting some more education and resources into. Oh yes, and it is back there. Thank you for pointing that out, Jen. The pamphlet is actually on the back table for anybody who wants to take it today. It's just a very brief, it's a 1-pager front and back that has just kind of minimal basic information for a family member who might have just seen a loved one overdose, for instance, on kind of some basics around addiction. What are some resources that they can access? We need to be doing more of that, and one of the things that we've also been talking about, and I'm actually in the early stages of planning a training for the police department, and then for several other municipal departments of frontline staff who may interact with the public around this issue, just to kind of give them some basics on how to use motivational interviewing skills and how to be aware of some of the resources that are out there that they can actually direct community members to. Because right now, our concern is that if somebody picks up and cold calls somebody in town, most often people will just direct them to me, but I can't be everywhere at all times, and so we need to have more folks in the town educated on how to help folks in the public around this issue. Those expert screenings that Tim mentioned, I've actually helped Karen Rufo, who's the district lead nurse for the public schools. I've participated in all of those screenings, and I've helped do all those screenings in the 7th and 8th grades. I also helped coordinate setting up that diversion program for youth between ages of 14 and 18 here in the community, which both the schools and the police department can refer to for youth who have a first-time offense related to substance use or possession. And then that interface referral line that Tim mentioned That is a referral line that is available. It initially was available just to students and their families, but now, as I understand it, is now going to be available community-wide, which is great because you can just call anonymously and somebody, a clinician on the other end of the line, will help you seek out counseling services. The drawbacks or the challenges for this particular conversation we're having tonight is that it's only available Monday through Friday, 9 to 5, and it is also really focused on outpatient services. So if you've got somebody you're worried about who really needs a residential placement or detox, that sort of thing, they're not the folks who would be able to help facilitate that. They could probably give you a phone number to like the psychiatric emergency services or to your local emergency department to go get a screening that might qualify you for a treatment facility like that. But we need help, providing those kinds of resources to folks on how they can get into treatment. And that's an issue every community in Massachusetts is currently dealing with, unfortunately. A few quick other things. We now have an annual vigil that the Interfaith Clergy here in Natick has been kind enough to sponsor with us for the past couple of years. Vicki Guest from the First Congregational Church has been kind enough to take a lead role in that. We've been working closely with the recovery community and their families through our connections to SOAR Natick and to the Mass Organization for Addiction Recovery. And frankly, at this point, most of the time, if somebody's really stuck and not sure where to go, a lot of times if it's a guidance counselor or social worker or just a member of the community who found my number or saw our Facebook page or something, people will often call me and I'll do what I can to try to connect them to services or give them a phone number or call somebody from a treatment provider that I know to see if I can help make a connection. But again, it feels like we need something more structured or organized to help folks there. And then I'm also involved in a number of different committees at the schools, advising and wellness initiatives and that sort of thing. So just a quick overview of some of the challenges that I already mentioned in this presentation. That funding and overall sustainability is certainly a challenge for Natick Together for Youth that we're currently facing, and we know that we need to have conversations in the town about how to approach those challenges. Also just kind of figuring out where NT Live kind of fits into the larger community infrastructure, or I should say the town infrastructure. We clearly have a lot of the players relevant to this topic already involved in the coalition, and we have some really great partnerships in play. But how do we address the opioid issue when we also are somewhat limited in our capacity as a coalition with our current funding structure to really be able to coordinate all the work that needs to happen there? And then also increasing community awareness in the community around what a coalition model truly is. So sometimes it can be kind of confusing to folks about why am I not providing direct counseling services to folks. And that's, as a coalition director, and my role is to try to work with all the clinicians out there to make sure that I can connect people to them or make people aware of them, but I can't provide direct services out of my office, and so sometimes that can be a little confusing for folks in the community. And then lastly, but again, one of the bigger points that I hope I drove home is that we need help. Families in this community really need help navigating the treatment systems. It's so confusing. You practically need a PhD to understand it. And so frequently the way this works in our Commonwealth currently is that you have to know somebody on the inside or just start cold calling facilities to see where you'll be able to get in. And that can be, you can imagine that sometimes that window of openness for treatment can be so small that if you then are told, oh, sorry, nothing right now, call back in 3 hours or call back tomorrow, maybe you'll luck out, that can become incredibly deflating for an individual who's ready for treatment or for their family who felt like, okay, we're ready to do something and now we've been totally undermined by a system that doesn't support that move towards change. That's not a Natick specific problem, it's a Commonwealth problem, but we in Natick need to be figuring out how we can help our residents navigate that. So thank you for listening to my diatribe. I appreciate you hanging in there for the whole time. If you have any questions, we'll take them in a few minutes, I think.
Thank you, Katie. I think a great job of presenting what's being done in town now. I know I got a couple of requests in my ear about the slides. When our next guest is speaking, I'm going to slide over to that side of the room and speak to the town administrator to see if we can put these up on the town's website somewhere. But our final speaker for the evening is Cheryl Center, who comes to us representing SOAR, Support Our Addicts Recovery. Cheryl?
wanted to start by thanking the board for designating this entire meeting tonight to the opioid crisis. It's something so near and dear to my heart and has touched my family, and I know so many other families that it's touched too, so I really appreciate you guys putting this at the top of your agenda. I'm here tonight to speak as a member of SOAR Natick. I hope a lot of what I say isn't repetitive. It's always hard to be last. There's been a lot said that's really good stuff. I'll try to skim over things that might be repetitious from what you've already heard, but SOAR stands for Supporting Our Addicts Recovery. And we started SOAR, a group of, really it turned out to be mothers, but it didn't need to be. It was families that had a loved one that was suffering from addiction. And it was such an undercover thing. Nobody wanted to talk about it publicly, so you needed a place to go and be able to meet and just chat about it, besides like a Panera Bread over coffee. You know, we just had to start something. So we did, and we started just a little over 2 years ago, and it's been a great resource to me and, you know, dozens of other people that have attended the meetings and continue to do so. We meet actually right here at the library on a bi-weekly basis, and we have an email chain and a Facebook page. If anybody's interested, you can approach me after the meeting and I can give you some more info. So what we really do is support each other when we have a loved one suffering from substance use disorder, which most people know as addiction. And addiction, especially to opiates, is a long and difficult journey for everyone it touches. So I try not to do that. It can result in parents asking their kids to leave their homes, siblings distancing themselves, marriages falling apart. The stories are painful and heartbreaking. And worst of all, young people are dying. It's happening right here in our community, and there's no boundaries to who it might touch. In every neighborhood in Natick, someone knows of someone dealing with this disease. You might think it won't touch you. You have good kids and a nice family. You might volunteer at school, coach sports teams, or give back to the community in some other way. You take vacations as a family, and you know you're good friends. You're all your kids' friends. Guess what? There's no guarantee that you're doing all the right things and that you'll protect your kids and your family from this. Addiction to opiates often begins with a prescription, following procedures that almost all of our kids go through. Extraction of wisdom teeth or treatment for a painful injury. Highly addictive pain medications are often prescribed, like Percocet, Vicodin, and oxycodone. Early signs of a problem may be that things from your home are start going missing. Jewelry, cash, credit cards, other valuables. This happens when prescriptions run out and addicts begin purchasing their drugs on the street. When this expense becomes too much, an addict may turn to heroin as a more affordable alternative. And as you heard said tonight, yes, there's heroin in Natick. It's happening here. And it's not as uncommon as you may think. The stigma associated with all of this is incredible. You feel so alone. It's time to recognize that addiction is not just a family crisis, something to be kept in the closet. It's a community crisis, and we need a coordinated effort to address it. Isn't that what Natick's all about? Options for treatment are difficult to find. You heard Katie just mention that a few minutes ago. Availability is limited and can be really expensive. Families sometimes use their retirement accounts and remortgage their homes to pay to save their kids' lives. There's no one place in Natick that you can go to find help. Family members need to know where they can go for information for themselves and their loved ones. Good work's being done by Natick Together for Youth and SOAR, both organizations running without any town funding. But we need more. We need social workers or counselors that are skilled at working with addicts. We need materials and resources to offer them. We need information that can be found easily, collected anonymously, and reviewed in private. While Natick Together for Youth is working on prevention and SOAR is offering families support, and our first responders are out saving lives, we need to find a way to take the next step to do whatever we can to pull these efforts together and offer resources to people and guide them to treatment. I want to praise the many departments here that are represented here tonight that have done so many things to make a difference. Now it's time for all the departments in our town to join together and begin a collaborative effort to help families that are in trouble. My hope tonight is that you recommend a task force be formed with a representative from each of these key departments within the town to begin addressing this issue as a community. Some of the goals of the task force might be appoint one person to take the lead on the opiate crisis and be the go-to department for anyone looking for help. Gather and prepare resource materials and make them accessible. Provide access to a clinician, social worker, someone in that type of role as a resource to the community, as well as our departments like the Natick Police Department, to be able to guide people in need. Do more public outreach about the opioid crisis. Develop and use signage to warn and direct the community about things like the Good Samaritan Law and clusters of overdoses. Have warning signs with resource information near hotspots, meaning areas where you know that drug use is more common. Using electronic signs and Pegasus notifications when appropriate. Partner with our local emergency rooms to develop a system for how to handle an overdose patient when brought in by our first responders. Trust me, no one wants to go to Leonard Morse when they're having an overdose. We need to address that. We have to get the hospital to step up with us. We need to start partnering with local treatment providers and improve access to affordable, or better yet, free Narcan. I took a poll of the 4 pharmacies that we have in Natick, only 2 of them even offer it. And if you are paying cash for it, it costs $150. So it's not affordable, and it's not as available as it ought to be. Those are my suggestions, and I thank you for your time tonight and for your attention to such an important topic.
Thank you, Cheryl, and thank you to all the speakers who have presented quite an array and a detailed list of things that need to be worked on and created awareness in our community. At this time, what we would like to do is have a Q&A session. There are cards on the chairs, and for those who would like to write down a question and send it up here, I'd be happy to read that question. If you wish to call it anonymously, or whatever, you just don't feel like standing up and speaking with a microphone, which I typically don't like to do, but Mr. Ostroff actually taught me how to do it. And all kidding aside, is there anybody that would like to ask a question?
Mr. Chair?
Oh, there we go. My apologies. Mr. Conley asked me about a half hour ago. Mr. Conley, please, I appreciate you calling me out.
Thank you. First of all, I've been part of the board for on and off for a few years.
Yes, it is.
On and off over the last few years. And it's no secret that I've never really seen eye to eye with a lot of our board members in administration. However, this evening, because of this effort, I've never been more proud of Ms. White, thank you, and administration, and this particular body of selecting that are support of this effort. You're helping me to keep a campaign promise I made a couple of years ago. For the last couple of years, anybody in the room that knows me knows I've been talking about heroin and its effect on people in town of Natick as well as everywhere else. But with all the chief hits and Mr. Love's stats and numbers, is every one of them is a real person behind the scene. And I'm no different. My sister's in the front row. Our brother was in prison. He's 50 years old because of his addiction. Sorry, Nancy, the perception. My nephew's in recovery. My niece is dead. My niece lost her life to opiate abuse, heroin, after she spent 3 years in MCI. Cutest little thing. That a lot of people in this room, I've seen you guys go through the struggles and the horror and the pain. It sucks. I'm frustrated. I'm angry. I was at Honey Farms over the last Thursday. I see two guys I know, they're telling me a couple doors down, another kid died of an overdose, heroin overdose. I'm like, you gotta be kidding me. A couple days later, I see his mother, and now I get a name and a face. Another kid, 25 years old, right there. Again, I couldn't be more grateful to our board and administration for hosting this event. As I said, a lot of you, I've seen the pain. Everyone in this room, it's real stories. The stats and numbers don't do it justice. The lying, the stealing, what did he burn out? Nancy, $90,000. My own brother, my own mother. So this one I know real well. Very few things. I'm no engineer. I'm no lawyer. I'm just simple. But very few things I bring to the board that I know something about, and this is one of them I wish I didn't. And Ms. Lucenta, your son's a great kid.
Thank you.
And who I know personally. And I see people in this room, I know their parents that have lost their children. It is brutal. It is a living hell. Anyone that's going through it knows what I'm talking about. And Ms. Lucenta, once again, the treatment facility, you call, anybody in the room that's had to call a treatment facility, they treat you like you're a leper. No beds, and what's your insurance? Call back tomorrow. I remember I was out trying to help my brother-in-law. I must have called 8 places before, and they treat you like crap. They treat you like crap. They treat you like you're crap. And it's like, isn't this your job? And the doctor says to me, "No, this is about the first one of 80 of these I'll see today." And I'm like, really? You gotta be kidding me. This wasn't one of Moore's, this was Milton. So I gotta be honest, and Eric, I saw you over the weekend, I was venting to you about this on Dunkin' Donuts, and I'm angry, and I've never been really big on holding my emotions back, and quite frankly, it pisses me off. And this one I heard about last week down there on Route 27, I felt like I had blood on my hands, because I'm like, I should be able to do more. I don't know who I think I am, I don't think it's an ego thing, it's just, it is killing me that young people are going through this. It's such a waste, and it's heartbreaking, and it's sad. And I appreciate the opportunity, Mr. Chair, that I do have 2 questions. The second one, if I could do first, is in this room, anybody that can answer me the question. Right now, I mean, 15, 20 years ago, everyone had a cancer-related story, a loved one that's fighting cancer, going through cancer, etc. Today, everyone in this room has an opiate story, a heroin story, whether it's your son, daughter, neighbor, aunt, uncle, somebody. The kid that lived down the street, nice kid that stole your weed whacker to support his habit now. My question is, with all the information that is out there, maybe some of the younger people, why in God's green earth would somebody pick it up today? I've heard the story, well, I thought I could handle it. I mean, you can't. You may be able to handle some things, but you can't control heroin. You do it, and it does you. So here's my question. The other question is, and I'm not trying to throw anyone under the bus, but I need a better understanding, Mr. Chair, to however you want to guide it, from the Natick Police and the Natick Schools regarding the K-9 officer in Natick High School. I've heard different stories of what, has that happened? Will it happen? Do they have full access? If somebody can answer that question for me, because I've heard conflicting reports, if somebody can answer those 2 questions, I'd be very grateful. Either way, I'm grateful for being here.
First, John, thank you very much for having a personal experience in this event that we're having this evening. Is there anybody that would like to answer one or both of those questions for Mr. Conway? Can't hear me? Oh, you couldn't hear his question. The schools, one of the questions was the schools, whether or not the police dog, the canine dog, is effectively inspecting the schools for these drugs. And let's start with that one. Mr. Luff, would you like to jump in on that?
What I can share about the canine search practice is that the school committee has been in vigorous discussion about the best way to implement those practices. There is members of the school committee that certainly provide the superintendent the ability to do that. We have conducted searches. I do not believe that we had one last year. We had one last year. Looking at Chief Hicks over here, but we will conduct those at various moments in time.
Mr. Chair, can I continue?
If you bring that closer to yourself.
Mr. Love, the question I had is, if and when the dog officer and his canine comes in, do they have full access to the entire building, or is it restricted?
I can't answer that question. Not that I just don't know the answer to that question, to be honest with you. Maybe I don't know if Chief Hicks can help me with that, possibly. I apologize.
I think the best answer to that is that there is a process that's in place. We work very closely with the school principal to set these up. The principal last year was fairly new, but was still very supportive of the program. And he works very closely when we do have, in this case, when we had the one incident, not one incident, but the one instance in when we did use a canine, he worked very closely with the canine officer to address what he thought was a need at that particular time. So, Mr. Conley, to your point, do we have complete access? Really, we don't need complete access with a canine because one canine can't do the whole building. We can get more in there if we need, but most of the time, so far, it's been very concentrated in a certain area. I know that we've had discussion, and my belief, if we need to do more areas, we would be allowed to.
That's good news, because I know, in particular, there was a 17-year-old, which would have been going to Natick, that will not see his graduation because he's dead from his heroin addiction. So, in my opinion, if the dog's going to go through, let him go through, and let him go through every single inch of the building. And if we need to bring in assistant canines, I know that's a resource we could avail, because we've also done it with other towns, assisting them in their efforts. So, we still want to thank you for that.
And John's other question was, why would the youth of today take this habit up? Why would somebody, even maybe even not a habit, but just take it up? And is there somebody who would like to speak to that? The young lady here in the back.
Yeah, I wanted to talk about an experiment. I don't know if you're aware of this. It happened around 1970, the rat park experiment. And these were in response to experiments on rats that were done in isolation. The rats were in isolated cages. They were given water and heroin-laced water. And they chose to drink the heroin-laced water. And they drank that until they died. Okay, so the conclusion of this experiment was to say that heroin is so addictive, animals, including humans, will just take it until they die. Well, someone disagreed with that. Bruce K. Alexander developed another set of experiments that he called Rat Park. And he built a playground for rats. He let them socialize. They were together, they could mate freely, they could run on the rat wheel if they wanted to. They had food, they had water, and they also had access to the heroin-laced water. And most of those rats, they took one sip of that and they never touched it again. So the conclusion that he drew from this was that rats are highly social, sexual, industrious creatures. We may say the same things about teenagers. And if we provide an opportunity for them to be free to exercise their will, then they may not touch that heroin water again. I want to offer another quote. This is from Kevin Soling from the Harvard Graduate School of Education, also the director of the documentary, The War on Kids. He says, it's important to realize that anxiety and distress are created by the institution. When students act out, feel depressed, apathetic, cynical, violent, antisocial, neurotic, helpless, suicidal, stressed, etc., the school environment is a significant catalyst. This condition is known as learned helplessness. Schools go one step further and train students to turn all the psychological problems created by the system against themselves. Schools make children believe that they are defective because they suffer when they are placed in an oppressive environment. And I know our schools in Natick are full of people who are trying to do good things, but it is very important if we're going to face this issue, the reality and the horror, as John said, of this issue, we need to face that the schools, the public school system, the structure of it is oppressive. It's dehumanizing. And if we look at the statistics, the curriculums, the banking method of education in which we deposit information in the children and then ask for it back without any opportunity for students to exercise their will, then those statistics and those curriculums are not so much part of the solution as part of the problem, and we need to face that.
Laura,
I was going to just ask, I wasn't sure if you had introduced yourself, and if you could, I'd appreciate it. In what capacity you're speaking?
Okay. My name is Amy Mevarak. I run an open mic for youth in Natick.
Where is that open mic held, can I ask?
Yeah, at Common Street Spiritual Center.
Common Street Spiritual Center, thank you.
My name is Rob Ryan. I am a person in long-term recovery, and for me, that is... Thank you. For me, that is, I have not consumed a drink or a drug for 3.5 years now. Thank you. It is great to see this coalition here. I grew up in Wayland, so I hold this town and surrounding towns close to my heart. I, did my abuse in these areas. I got sober in these areas, and I'm trying to give back to these areas. So, to answer your question quite directly, it's a, as someone that has gone through it myself, and from what I've learned with communication with various friends that struggle with the same things, and what I've learned being involved in the field, there's many different reasons why you would consume a drug like heroin. Nature versus nurture, how you're raised, how you're genetically predisposed. But a lot of what I see with drug use in general, alcohol use in general, is a coping skill. As young adults, we hit an age of fear, doubt, and insecurity, and unless we have healthy coping skills that can be provided through information, like the woman was saying earlier about Rat Park, how to properly interact, how to navigate life in general. And if we stumble upon drugs and alcohol, we find ourselves latching onto that for a coping skill that helps us socialize, and take us down the wrong path. Like I said, it's a coping skill related to majority of users with trauma. But like we said, this is a nice town like Natick. Sometimes there's just an X factor of I know many people like we've said that come from a nice town, and maybe they fell into it through the getting a surgery, or just happening to take it, not understanding what they're doing. But it always comes down to a coping skill that you may not have been missing when you fell into the drugs, but getting out of the drugs is always the factor in leaving it behind, because you can take someone that's physically dependent on drugs and send them to detox, and when they get out, this person has been using maybe their whole young adult life, and they do not have the proper coping skills necessary to combat life. And from what I see in my personal life and the lives of many of my friends that are in recovery, it's a peer-led system. You ask yourselves, what can we do to help the individual that is addicted right now? Intervention is the number one thing to get them taken out. Treatment, to assess what level of treatment they need, and to help them get that level of treatment, which is like we've said, very difficult. Through various peer-led programs and peer support is what I see, like we said with the experiment, is what works. Getting people involved in recovery-based programs in your community. So that was the question I wanted to answer your question. So my question is I am also a recovery coach. I left my card up there. Me and my partner run a recovery coaching business, and I'm also a full-time recovery coach in a hospital. And my question is if the town of Natick, the police force, or if the hospital have any plans to hire recovery coaches to be on scene for overdoses, or to have them present 24/7 at the hospital to assess the treatment and to help navigate them through this difficult system that seems sometimes pinned against us. So I hope that was informative, and thank you.
Thank you very much, I appreciate that. We have collected a number of questions. I think that's a nice way to put it. And to be honest with you, we have to be out here in about 18 minutes. The library closes, so we've come to realize that this is not going to be something that we can accomplish all in one evening. And I can assure you that we are going to continue this. As I mentioned, this is one of the goals of the Board of Selectmen, is to make this issue become prominent in the public's awareness. I'm going to ask Ms. White to address a number of the questions here as an overall overview, if you will, as to how we might approach it, and then we'll move on forward. Ms. White.
Hi, everyone. I'm Martha White. I'm the town administrator, and I'm just going to run through some of the questions quickly, and I'm going to read all of them, but some of them we're just not going to be able to answer tonight. But I thought Cheryl's suggestion of a task force, we already have somewhat of an informal task force, but I think formalizing it is a wonderful idea, and I'm sure the board will want to talk about that. We'll include it on their agenda Monday night. And your suggestions as to what their tasks and responsibilities should be were good ones, and I'd ask you to email that to me if you wouldn't mind. Thank you. So someone asked if police and firefighters and EMTs have been trained to give Narcan. Yes, every single one of them. There is Narcan on every emergency response vehicle, fire trucks, ambulances, and police cruisers, and they all know how to use it. Can private citizens be trained? Well, yes, they can, can't they, Mr. Conway? And where do private citizens go to do that?
Ms. Sugarman has courses or training seminars that she's held.
Right, well, just so it's on the microphone. So the easiest and quickest way to get free Narcan is to go to the Learn to Cope meetings in Framingham on Wednesday evenings, 7 o'clock, is that right? 7 o'clock at the Edward Kennedy Community Health Center in downtown Framingham. Every Wednesday night, there are meetings there for Learn to Cope, and you can get free Narcan and get trained on the spot. Beyond that, there are approved pilot sites across the state that are approved by the Mass Department of Public Health, and if you just Google Mass Department of Public Health Narcan pilot sites, you can find the whole listing. But those are treatment facilities primarily. So in most of those cases, you actually have to be like a patient or a family member of a patient within that treatment provider system of services to get trained and to get to the Narcan. So otherwise, the only other option is to go to a pharmacy like Cheryl mentioned, but not all of them are equipped to actually fill that. So.
Kate, just to let you know, Jones's drugstore
Yes.
informed me last week that they have 2 people that have been trained in the Narcan, and they do now have carry it, and they will train people on site to be able to use it.
Awesome. So you didn't hear that. Cheryl, do you mind, what were the other 2 pharmacies in town who had it?
CVS and Walgreens.
CVS and Walgreens. So CVS, Walgreens, and Jones all now carry Narcan. So, but you will have to talk to them directly and call ahead. That's one of the other tips we recently got. Call ahead to let them know that you're coming to get the Narcan, so they can make sure somebody's actually available to walk you through how to use it.
And Jim, that was Jim White that spoke from the audience. Jim, did you also say that Jones Drugs would train people in the use of Narcan?
They have been trained in how to administer it, and they will hands-on train somebody there.
So Jones Drugs has been trained, and they may not be the only pharmacy in town with this offer, but they have folks that have been trained in administering Narcan, and they will train other people.
They have 2 people, so Katie's suggestion of calling ahead to make sure
Yes.
either one of them is on
Calling ahead,
staff
making
is a
sure
great
they're
idea.
available.
Absolutely.
Terrific. This same person also asked about, can private citizens do ride-alongs with police? You know, and I'm assuming no. Lieutenant Rossi Caparelli?
I'm on the website, you can get my email if you're interested in it.
Oh, okay, so we do allow ride-alongs. Yikes. Obviously, a waiver is required. You can go to the police department webpage and look for Lieutenant Rossi Caparelli. Carol, would you mind standing up so people know who you are? This is Lieutenant Rossi Caparelli. And she can help arrange that. There are other more complex questions in here that obviously can't be answered tonight on the same note card. How do mental health issues impact opioid use? Again, something we're not going to be able to address in tonight's brief session, but what I think we've learned, what I have learned most from this session, and I've learned a lot, is that we need to be doing more of these kinds of programs. So I think, without putting the board on the spot, which I'm about to, I think we can count on more of these kinds of sessions, more information on the website, and having the task force, which I'm sure will be formed. I think I can speak safely at that point. Having the task force tackle some of these questions. I'll hang on to these and make sure they're passed on. Another one is, would the selectmen support a town social worker who could refer to evidence-based treatment programs? Yes, we actually already have that. We have a social worker at the Human Services Department, which is housed at the Community Senior Center, and there are referrals that can be made from there. There are also social workers in the school department, I believe, that can make similar referrals. So we actually do already offer that service. To Representative Linsky. I actually can't read. Oh, I see. Are our state and federal legislators offering any legislation to change drug offenses from criminal charges to rehabilitation in some cases of early offenses?
The answer is, I don't see the legislature decriminalizing drugs. I just don't see that as a, but I think the easiest way to answer that is that I think that most law enforcement people would tell you right now that as far as simple possession of drugs by people who have drug problems, prosecution is a last resort. That there are a number of diversion programs, both formal and informal, when a law enforcement officer comes upon someone in that type of situation. And I, just knowing how these things work, being in law enforcement myself for many years, there are a number of steps before something actually gets prosecuted. So I think that clearly, and then from speaking in my legislative role, I have to say that there is a complete understanding now that we are never going to arrest and prosecute our way out of this problem, and that we're clearly moving in a rehabilitation direction. We passed an opioid bill during this legislative session that's now wrapping up that I was proud to vote for, but under no circumstances do I think that I have any or all of the answers, and that is frankly why I'm here tonight. I totally applaud the Board of Selectmen, and particularly John, for really pushing this issue forward. As most of you know, I'm the father of 3 sons who are right in the sweet spot, if you will, of this age group. And over the past couple of years, I've gone to Everett too many times. And, you know, just one kid that I coached in movie, quite frankly. You know, just terrible. You know, we as a community, I'm incredibly proud of this community, of things like this and everything we're pulling together. But we've got to figure out something. But we're not going to just figure it out here. You know, that I can tell you that there's a number of us in the state legislature, to a person, and particularly Speaker DeLeo, we're going to do anything we possibly can. But we need to figure out what that is, and that's just why we're here. So.
Thank you, Representative Linsky. Excuse me. We have a question about what Natick High School has done in response to the recent death of a student due to a heroin overdose. How is the news given to the students, and what support has been offered? Thank you.
Well, we've certainly been sensitive to the situation and took the lead of the parents in this particular case. Friends of the student that we knew were reached out to and provided with the opportunity to get direct support in time of need. We also met with the parents of both situations, students, and continue to build our curriculum and support students as much as we can in this time of need. But again, sensitivity was taken to the parents' needs and respect to the families were taken at the time. But certainly the efforts to continue looking at the opioid issues in the schools, such as joining in community events such as tonight, would be ongoing.
Thank you. Do Natick High School students receive CPR training? Why, in fact, I think most of them have been trained, have they not? Chief White, Fire Chief Rick White is here this evening, along with several other department heads and officials. And the Natick Fire Department has been training high school students for several years now, and at this point, everyone should have been trained. Can education on spotting signs of an overdose be reviewed there in addition to classes and assemblies? And I think that that is, again, another thing the task force would be taking up. Cheryl, I'm sorry, I'm trying to drop in this one on you. Does SOAR have a partnership with the middle school? And specifically regarding discussions, education, and confidential.
SOAR is actually formed just as a support group for families. There are a select number of people out of that group that choose to work on community outreach. And we have done things with the police department and with Natick Together for Youth. Not especially with the schools and definitely not in the middle schools, but I know that Chief could probably speak to what school resource officers are doing in that role at the middle school level.
Thank you, Cheryl. We have recognized, and with the support of both the schools, the Board of Selectmen, and also town meeting, to work on addressing this issue coming up with the next school year. It was approved for an additional school resource officer. So we're going to have one in each middle school as opposed to one covering both. And with that, the plans are moving forward to this school year that will be one of the focuses of these school resource officers, to work on this area and work on the middle school age children from this point on. And again, I'd be remiss if I didn't thank the Board of Selectmen for supporting it, the town administrator, the school committee, the school superintendent, and the town meeting for helping us get to that point this year. Thank you.
So again, I think among the things we've learned tonight is how much more we need to be doing. So I'm going to read off several of the cards because I want everybody who took the time to pose a question to be sure that it's something that we will look to find the answers. And again, these are items that I believe would be appropriately taken up by the task force. Identifying the steps that one could take to help an addict and ways to support families, coordinate volunteer opportunities for the addict, crafts and community reinforcement and family training. Oh, I see, craft, community reinforcement and family training. Is there education for parents who think it's okay to drink or smoke cannabis with their children? Good topic to take up. Could our health department work with Leonard Morris to improve their services for overdose patients in their emergency department? Currently it is, I'm reading these just to say what word. Currently it is treat and street in quotation marks.
Stigma. Big time.
A stigmatization kind of issue, yes. As Natick educators of preschool and school-age children, what can we do now to secure their future? Parent workshops regarding lifestyle changes and what to look for. Home and lifestyle changes. Is there going to be more focus on treatment and maintenance for non-school community members, and also as well hepatitis C? Where does the town go from here? Need more information from the police. A united front needed. Real-life police stories about their efforts. This person noticed that athletes are targeted as an audience group for prevention of education. I think that was cited due to the tendency for there to be injuries that might cause a prescription or trigger a prescription for painkillers. But how about other groups also being given focused attention? So I think, again, these are all really important questions and issues that again, we don't have the answers for tonight, but they highlight how much more we all need to do.
Thank you, Ms. White. Thank you all for putting forward those questions, and I would also suggest that if we could get rid of the PA system in this room, we'd all be really happy. She heard me. All kidding aside, this has been an extremely informational evening for myself, and I am sure for my fellow board members. I don't think you have to be told that there's passion on our board to make something happen with this. And Mr. Conley is the spearhead of that effort, and he will continue to be so, and he has been. And his fellow board members also feel that passion. We will move forward, discuss this further. Hopefully the task force can come forward with some good initiatives that will help the community come together, one of which is to remove the stigma and have the parents or the families or the individuals who have these issues feel comfortable in coming in, if you will, and being able to deal with it rather than being fearful of being arrested or penalized in some way, but to be allowed to come in and say, I need help. And to me, that's the most important role that we as a community need to develop. Again, thank you all for coming this evening. The board is very proud of the community of Natick, and we will continue to serve this issue. Thank you again, and have a pleasant, safe drive.
One quick thing to get back to you on the presentations and slideshows you had today. Town Administrator Martha White said that she will, on the town's website, create a special link for this event here tonight to include all the presentations and probably the video that's being taken by Mr. Oswald out front here. So again, on behalf of the presenters here, we do have some more work. This is not the last time you'll see us. Those are very valid questions, and we will work to make sure we get able to answer them. Again, have a good night, and thank you very much.